In this lesson, we will study ICD-10-CM Chapter 19, titled Injury, Poisoning, and Certain Other Consequences of External Causes, covering code ranges S00 through T88. This lesson is for educational purposes only. Please refer to official ICD-10-CM guidelines. Learning objectives. After completing this lesson, you should be able to apply 7th character rules correctly, differentiate initial, subsequent, and sequela encounters, code injuries, fractures, burns, poisonings, and complications accurately, and avoid common CPC examination errors related to Chapter 19. Chapter 19 Exam Importance. Chapter 19 is frequently tested because it contains strict 7th character requirements, complex fracture and burn rules, and high-risk areas such as poisoning versus adverse effects. Remember, an incorrect 7th character automatically results in an incorrect exam answer. 7th character overview. Most Chapter 19 codes require a 7th character to identify the encounter. A for initial encounter, D for subsequent encounter, S for sequela. Fracture codes include additional 7th character options beyond these three. Initial encounter, A. Use the 7th character, A, when the patient is receiving active treatment. Active treatment includes emergency department care, surgical treatment, and ongoing evaluation and management. Important exam rule. The provider being new does not make it an initial encounter. The encounter type depends only on the stage of treatment. Subsequent encounter, D. Use the 7th character, D, when active treatment has ended and the patient is receiving routine care during healing or recovery. Do not assign aftercare Z codes for injuries or poisonings. The subsequent encounter 7th character replaces aftercare coding. Sequela, S. Use the 7th character, S, for conditions that occur as a direct result of a prior injury. Examples include scarring after a burn, contractures following fractures. These are known as late effects. Sequela coding rule. When coding sequela, first, code the current residual condition, then code the original injury with 7th character, S. The S is applied only to the injury code, not to the residual condition. Multiple injuries. When a patient has multiple injuries, assign separate codes for each injury, unless a combination code exists. Code T07, unspecified multiple injuries, should rarely be used in inpatient settings and only when specific details are unavailable. Sequencing of injuries. When multiple injuries are present, sequence the most serious injury first, based on provider documentation and the focus of treatment. Superficial injuries. Superficial injuries such as abrasions or contusions are not coded when they occur at the same site as a more severe injury. This rule prevents overcoding. Nerve and blood vessel injuries. When a primary injury causes minor nerve or blood vessel damage, sequence the primary injury first, then assign additional codes for nerve or vessel injuries. If the nerve or vessel injury is the primary injury, then it is sequenced first. Iatrogenic injuries. Injuries caused by medical care are not coded as traumatic injuries. Instead, assign the appropriate complication of care codes. This is a frequent CPC exam trap. Fracture coding overview. Fractures are coded by anatomic site, laterality, displacement, open versus closed status, and encounter type. Default rules. If open or closed is not stated, right pointing arrow code is closed. If displaced status is not stated, right pointing arrow code is displaced. Fracture encounter rules. Use initial encounter fracture codes when the patient is receiving active treatment, treatment is delayed, or a non-union is treated for the first time. Subsequent fracture care. Use subsequent encounter fracture codes for routine healing, delayed healing, malunion, or non-union. Aftercare Z codes must never be used for traumatic fractures. Osteoporotic fractures. When a patient with known osteoporosis sustains a fracture from minimal trauma, assign a code from category M80, not a traumatic fracture code. Multiple and physeal fractures. Multiple fractures are sequenced by severity. For physeal fractures, assign only the physeal fracture code. Do not assign a separate code for the bone. Burns versus corrosions. Burn codes are used for thermal, electrical, and radiation burns. Corrosion codes are used for chemical burns. Coding rules apply equally to both. Burn sequencing. When multiple burns exist, sequence the highest degree burn first. If inhalation injury or respiratory failure is present, the circumstances of admission determine sequencing. Burns of the same site. When burns affect the same site and side, code only the highest degree burn documented. Extent of body surface, T31 T32, codes from T31 or T32 are used to report the extent of body surface involvement. They are based on the rule of nines and are used only for acute burns, not sequelae. Burn sequelae. For late effects of burns, assign the sequela condition first, followed by the burn code with 7th character, S. External cause codes are required. Poisoning versus adverse effect. An adverse effect occurs when the correct drug is properly administered, but causes an unwanted reaction. Code the reaction first, then the T code with 5th or 6th character, 5. A poisoning occurs due to overdose, wrong drug, or wrong route. Code the T code first, including intent. Underdosing. Underdosing occurs when the patient takes less medication than prescribed, or stops medication without provider instruction. Assign the T code with character 6. Underdosing codes are never principal diagnoses. Toxic effects. Toxic effects involve exposure to harmful substances. Code the toxic effect first, then assign codes for all associated manifestations. Abuse and neglect. Confirmed abuse is coded with T74. Suspected abuse is coded with T76. For confirmed abuse, assign external cause codes and perpetrator codes if known. For suspected abuse, do not assign external cause or perpetrator codes. Complications of care. A complication code is assigned only when the condition affects function, and it is clearly documented as a complication. Body system complication codes take priority unless indexed to Chapter 19. Transplant complications. Transplant complication codes are assigned only when the transplanted organ's function is affected. For kidney transplants, chronic kidney disease alone is not a complication. Failure or rejection is coded with T86.1. Common CPC exam errors. Common errors include incorrect 7th character usage, using aftercare Z codes for injuries, misclassifying poisonings and adverse effects, coding medical complications as trauma. Exam recall summary. Remember, A equals active treatment, D equals healing or recovery, S equals late effects. Burns are coded by highest degree, poisoning is not the same as adverse effect, complications must be clearly documented. Lesson 21 Summary. In this lesson, we covered 7th character rules, injury and fracture coding, burns and corrosions, poisoning, adverse effects, and underdosing, abuse and complications of care.